later you think, oh, I shouldn't have sent that, again, I think it's something that you should follow up with and clarify. Depending upon what the nature of it would be whether or not we would have to disclose it or report it to the OIG.
But I won't get in trouble if I make a mistake and come clean.
They'll be a lot more lenient with you. Your sentence might not be as long. Okay. If you do report a compliance issue or concern, there will be no retaliation or retribution for reporting. We want to hear if there's a problem. In most cases, they can be easily resolved. If you feel that you've been retaliated against because you did report a problem, report that issue to me. Anyone found retaliating will be disciplined and possibly terminated. You have different reporting options. As I mentioned, you can call me directly or email me, but you can also call our compliance hotline. And that is the number there for the compliance hotline. The compliance hotline is a toll-free number that you can report compliance concerns, either identifying yourself, or if you don't wish to do that, you can report a concern anonymously. If you report a concern anonymously, that's fine, but it may be more difficult to go ahead and investigate your issue because I can't get a hold of you to find more information. If you do report anonymously, give as much information as you can, and if later you have more to report, call the compliance line again and report more information. If you do report a concern, we will make reasonable attempts to keep your report confidential, but there could be instances that by the context of what you're reporting, you reveal your identity. But we will try to keep reports as confidential as we can. Okay, we have a compliance committee. You may not be aware that we have a compliance committee, but it meets every quarter after the quarterly QI meetings. The committee members include Dr. Norris, Bruce, Patty, Eva, Bill, Tom, and myself. The purpose of the compliance committee is to assist me with implementation and maintenance of our program, to work with staff, to develop standards of conduct and departmental policies and procedures to promote adherence to our compliance program. And recently, we started a risk assessment program to identify areas in the organization of high risk and to audit and monitor those areas. Operations has a policy regarding compliance audits, and this has been in place for many years. But each quarter, 70 charts are randomly selected and audited for their accuracy, their completeness, their adherence to Joint Commission standards. We aim for a compliance score of 95% or better, and any staff that's identified with ongoing deficiencies, they're given further training and they are monitored. We also match up the medical record with the billing encounter form or the text sheet to ensure that we accurately billed for the services that were completed. The billing office also has a quarterly audit, and it's an extensive audit. Their audit is to ensure that all aspects of the billing process are completed accurately and timely according to guidelines each department has set. Again, the text sheet and the charge batch are compared for accuracy. Records are checked to ensure that the correct physician was selected at charge entry. And we look at insurance claim rejection reports to identify any patterns or trends. We look at the EOBs and the site invoices, and those are audited for accurate billing and payment posting. So we have a couple of audits going on throughout the company. Our policies and our procedures. The Code of Conduct references several more detailed policies and procedures. In the past, last year, we passed all the supporting policies and procedures out to you. This year, we're not going to do that, but you can obtain any more detailed policies by either going to the Corporate Forms and Lists N drive, if you have access to that, or the employee portal of the Intranet. And it's under the username of United Therapies, and the password is UT123. That was in one of our employee newsletters. A very important compliance policy is the OIG exclusion review screening. Individuals excluded from participation in federal or state health care programs, for example, Medicare, Medicaid, or TRICARE, may not work in any capacity for a company that directly or indirectly receives payment from these federal health care programs. An excluded company cannot provide lithotripsy services to a hospital. United will not engage in any business relationships with any ineligible individual or any entity, as defined as anyone who is currently excluded, debarred, or otherwise ineligible to participate in federal health care programs and listed on the OIG exclusion list or the GSA excluded parties list. We cannot employ any excluded individual, and an excluded individual, a physician, cannot be a United investor. The effect of exclusion is very serious. It would be a violation to bill for services that were provided by anyone that's on the exclusion list. All money that is received from the services provided by an excluded individual would need to be refunded, and it's a reportable event under our CIA. We would need to report this to the OIG.
So, I have a question.
Sure.
So, let's say we have a verifier,
Right.
for example, that all of a sudden we discover sort of because of an alias, not an alias, but a married name or this or that was on the excluded list. I mean, how does that play into, I mean, would it be just cases that that person specifically verified that might be subject to?
Well, first of all, the person probably wouldn't be hired because at the time before the offer was made, if they're on the OIG exclusion list, we wouldn't make the offer of employment. But during the course of it, if they became on the list, if it isn't anybody that's, central to providing patient services, we would probably go back and try to find out from the OIG what we would need to do. I don't think a verifier we would have to worry about.
Okay.
So sometimes I think Marion had reported last year that the most common reason individuals are excluded is because they haven't paid back student loans. So haven't paid back student loans. That's the most common reason.
That exclusion from healthcare?
Yes.
Really?
Yes. So.
Oh.
So let's talk about screening. Why is it required? Per our policy, we screen all prospective employees prior to offering an employment, and we screen all physicians prior to granting practice privileges and on an annual basis thereafter. An eligible person also includes anyone who is convicted of a criminal offense for which exclusion is mandatory but not yet excluded, debarred, suspended, or otherwise declared ineligible. Currently, there's over 5,200 physicians alone excluded from participating in federal and healthcare state programs. We screen using the OIG list of excluded individuals and the General Services Administration list of parties excluded from federal programs. HR performs our employee screenings, and credentialing screens all credentialed physicians. We also check maiden names and any known aliases, and this information is on both our employment application and our physician credentialing applications. Focus arrangements. Since our CIA, we have written and implemented policies for our focus arrangements to ensure compliance with federal laws and our CIA obligations. All focus arrangements are in writing. All parties must sign the agreement. No services are to be provided without a written contract. We even have a written demo agreement that we can use to start treating cases while we negotiate a longer-term agreement. We have certification in the contract that the parties to the contract shall not violate the anti-kickback statute and the Stark Law, and we have to have a policy in place for record retention and access. We've developed a procedure to initiate new focus arrangements. This was developed in one of our first departmental-wide Kaizen events. We have a detailed policy and various checks and balances in place to ensure that our focus arrangements do not violate the anti-kickback statute or Stark Law. We have developed a centralized tracking system using an access database, which we term FATS, Focus Arrangement Tracking System, for all new and renewed focus arrangements. We're going to go into greater detail in the second session, but just to tell you right now, FATS complies with all the tracking requirements, and we've made it so it does, that are spelled out in our CIA. Jim Snelson, our Director of Provider Contracting, enters contract information into the database. We have our regulatory counsel review all of our focus arrangements for compliance with anti-kickback statute and Stark laws. And if there are any suspected violations discovered, we must implement an effective response. We must track the remuneration we receive other than the per procedure rate. We must have a business need or rationale. Almost always the business need is that the facility needs services, but we have to provide that information and track it. If our agreement is for lithotripsy, we must document and determine fair market value compensation. There are several areas in our company that we may encounter compliance concerns, and I thought what I would do is try to go over some of these areas and kind of make it more practical to your day-to-day activities. The first is the conflict of interest. We all know that conflicts of interest occur when decisions or actions regarding patients are influenced by personal or professional interest. Some instances that could potentially give rise to conflict of interest are purchasing or ordering of supplies. We should purchase supplies based on established criteria such as price, quality, and service. Gifts and entertainment. Do not accept gifts or services or entertainment or other items from a vendor. These may impact your decisions. Use of the company's property. The company's property and assets must only be used for legitimate business purposes. So those are some areas. Patient care. The way we treat our patients is the center of our reputation as an honest, fair, and ethical organization, and it supports our corporate value of integrity. We should always provide care to patients without regard to their race, religion, ethnic origin, gender, age, disability, or sexual orientation. We should communicate to our patients in a manner and a language that they can understand, and that's why at the centers we use the language line. And we should appropriately chart and document all the care that a patient receives. Privacy and confidentiality. We respect a patient's right to privacy and confidentiality. These rights are not new. But with HIPAA rules and regulations, there are penalties for violating a patient's right to confidentiality. We must adhere to all HIPAA privacy rules. HIPAA gives patients the right to have their information kept private and confidential and secure. Only staff members who need to know PHI, which is Protected Health Information, I'm saying some of these slow because hint, hint, it might be an answer later, to perform their jobs have access to it. Only the minimum necessary information to perform a job can be shared. We must take safeguards to protect PHI. For example, we make sure that our medical records are kept locked in file cabinets. We make sure that only those who need access to electronic data have it. Computers must be turned away from public view. We no longer post a list of the patients like we used to do in the centers with the names. And all PHI must be